Hello. Yes, Dr. Aya. Let's welcome Dr. Aya Salah. Dr. Aya Salah was also one of our intelligent candidates. Actually, she joined us late, but with huge amount of knowledge, huge amount of knowledge, and she want to ask about every single detail until she thankfully يعني passed with ما شاء الله الله أكبر يعني near full marks. Hi, Dr. Aya, introduce yourself and tell us about your story.
Thank you, Dr. Da. This is Dr. Aya Salah. Was my fourth time to enter the exam. I worked mainly here in Egypt. I was as just internal medicine, general, and in Saudi I worked in Saudi Arabia mainly for 3 years as only a GP. So I had to take this MRCB to become a specialist. Also, I tried many times, but Alhamdulillah, this time I got it. So I started my preparation. I think that my main problem that I took my first step at around 2022. This was my first step. Then also the second step only after 6 months from the first one. But about paces, I tried to join. I think my first mistake regarding the MRCB journey was preparing late. I only started to prepare good for the bases after I got a seat. I took courses and I entered the mock, but I think I didn't have the enough knowledge. Also, I don't think only the problem was in the knowledge, but I think it was only other than the knowledge. I think my problem was in my approach and lack of confidence. I tried many sources like Rider, like I studied all the 3 Rider books. This took from me many months, and I even at the end I mean in my last exam I didn't even take a look of them because I think it was totally a lot of time. What also other than Rider, I watched all the past videos. They were good. I mean, also especially in the short cases, they were good. I could recommend them, but mainly for the short cases. I think the Maghrebi notes and the mock I took mock mainly for with Dr. Ramadan, and I would recommend him. This is for the short. For the long clinical for LCC, I would recommend Dr. Roch cases. That was one of the main sources. Of course, Dr. Dua course. I studied all of her cases a lot, multiple times. Maybe I listened to to her lectures once, and then I will listen to her maybe twice and read the notes. I also practice them multiple times, only positive, and try to get the case and try to because some differential it could be. Some differential it must be in as a knowledge for some cases. For lingua clinical, other than the Roch and Dr. Dua, I used also Dr. Basim group to be exposed for more cases. What else regarding the communication? I listened to Dr. Da lecture maybe 3 or 4 times or even more. I even at the night of the exam, I didn't finish all the lecture until the night of the exam. I was studying them and finishing all my notes at the end. But this is mainly for the communication. I mainly used only Dr. Dua Roch and Dr. Dua course.
Okay, Dr. Aya, if you will like repeat this preparation because like spending so much time in Rider and the most test videos, if you will repeat the preparation with your current point of view, how would you go?
I would skip Rider at all.
Yes.
because I in the Facebook groups, in the Telegram groups, everyone is telling rider. This is why also I could see that it will not help because they are very long. They will give you a lot of knowledge, but without any how to use this knowledge.
Yes.
So I will not. I will totally skip the rider books.
Yes. Yes.
Bus
So
test video is not bad, but mainly to see how to approach. But mainly I used for the how to do the technique for the short cases. I mean used after that Dr. Salah videos or Dr. Mona videos or only at least the preparation because I always use the only during the mock. I didn't have the time to do the preparation of the for the short cases.
yes, yes, but if you like will do this again in more easier way, you will just maybe take organized course from the start, maybe start with us, and then like go for the clinical, and that's all.
Yes, sure.
Okay, tell us about your exam, the stations of LCC and communication.
I had the same exam of Dr. Riham.
Yes.
But I would also just regarding the I started mainly from the case the communication case the communication case was the corticosteroids. I have lost a lot of marks for this one because I was too afraid to tell about the corticosteroid sparing agents. He asked me at the end. I told him, but he told me, "Can I start them now?" or something like this. But I told him you can revise more with the consultant. Mainly in the communication, I like to follow to follow only the scheme. Whatever told in the scheme from outside, I will only tell. Even I had the knowledge, I was afraid to tell. I think this is why I lost so many scores in this one. I had to take 12 from 16.
Yes.
The second communication, it was about the DNR. I got for this one 15 out of 16. I think the wrong thing because she at the beginning she told me I want to why you are here. I want to meet the consultant. I was just scared in the I didn't say anything maybe for 20 seconds because I didn't I
Expect.
didn't
Shocked you.
yes
Yes.
yes I was shocked.
Yes.
Then I saw them that they are writing. Then everything went well. They didn't write anything more.
Yes.
For the LCC, I would recommend from anyone to just take a look on the patient as soon as you can see. Try to take a look on him. It was rectal bleeding because I know this case from before. I know this is a surgical case mainly. If it is not surgical, it will be cancer. I thought that from the beginning, I thought it could be rectal cancer. Then, as I know, because I saw this case before in Dr. Datim room, I thought it could be acromegaly. Then I took a look in the patient. I know that he is acromegaly. Also, the patient didn't have any weight changes. But the case mainly was acromegaly. They asked me, "What do you think more about what is the other definition other than the colon cancer?" I told them it could be only simple polyps or surgical cases as fissures or hemorrhoid. For this case, I got 28. I got the full mark. Also, I forgot to do the knee examination, and the patient had knee pain. I forgot to do the knee examination, and I forgot to do the X-ray on the knee. The other case, it was the case of COPD patient or a patient who was a smoker who was positive constitutional symptom. I asked about the TB, it was negative. And the main symptom from outside, it was weakness. I'm not sure what is the other symptom, but it mainly was weakness. I asked about if is it focal or generalized. It was mainly so. Then I started the approach of the fatigue. I asked about the constitutional. Then I examined his chest. I examined the lymph node, examined the abdomen, as mainly for the fatigue. Then they asked me about the differential. They asked me what do you think mainly the cause of the weakness now. Of course, I also did some neuro. I asked them to do some neuro. For everything, they told me to proceed. I did only for the neuro, only the hand grip and only the leg, to breathe on the leg, and it was fine. So because I thought that if the case is weakness, I should try for the neuro.
For the
Then
neuro,
they
but
asked me why you
he
did
meant
that.
generalized weakness, like generalized weakness with
Yes,
fatigue. Yes.
exactly. Yes, they asked me why you did the neuro. I told her, I told her because of the weakness. She told me this is too safe to do because they told me that there is no focal deficit.
Yes.
Uh, but I, uh, but what can I do now? Because I was afraid to do an in the LCT. I usually forget to do some neurological examination. But
Yes.
from the beginning, I wrote that I want to do the neuro, so I just do it maybe for 10 seconds.
Yes.
Then
Yes. Better safe than sorry.
I
Yes.
yes, exactly.
Yes.
Then I got the definition as it could be malignancy. I would also do chest X-ray searching for a TB and at least searching for latent TB. They asked me if I want to do MRI of the brain. I told her yes, I could do it, searching for after asking my senior to check if there is any myths to the brain.
Yes.
And this one also I got the 28. I got the
Excellent.
full mark.
Excellent, Dr. A. Excellent, Dr. A. Okay, so last advice for someone who will got their seat next diet, inshallah, like in 10 seconds. Huh.
I will tell them to just be confident as they can, to start preparation very early as they can, to practice a lot and to take extended courses. What I mean by extended courses, because I took courses that can take a week or 10 days. This usually does not allow you to study well. So extended courses that, as your course that takes 2 to 3 months, it's better for studying and practicing.
Yes, and to stick to the same approach until like the day of the exam.
Yes, exactly. Yes, and the other thing, even if you had one of the stations, you feel that I think that I left the chest station that it was very bad for me. Also, I get 20 at the end, but I think all the other station after the chest one was very bad because I was thinking about the chest one.
Yes, yes, and actually, like the examiner impression, the didn't mean that you got like a bad mark. Maybe the examiner impression is so bad and you got full mark at the end. Yes, this is his mask face only.
Yes.
Yes, yes, yes. Thank you, Dr. Aya. Congratulations again and again for your great success. Hope you all the best. Okay, I will miss you. Okay, Dr. Aya, thank you. Dr. Islam, are you here?